All right. Well, welcome back. And thank you for joining us again this week. Last week, we talked about meal planning and tips and tricks to boost your nutrition, increase plant foods, and help you make yourself a healthier you. But this week, we're transitioning into medicines. And do you know what your medicines are doing to you and for you? And before we get into this, I want to say that a medical disclaimer: we are not doctors. We are not licensed practitioners. We are not telling you to go off of medication. There are medicines that can save lives. There are reasons why people are on medications, but we want to make sure you understand your medications. We are educators. We're educating you. We want you to be your own advocate, and we want you to make educated decisions. So that's why we are here today. So we're going to be talking a lot about how different medications can interact with different things, what they're doing in your body, and foods that sometimes and herbs that sometimes can be used in place of medicines that maybe you can learn more about. Anyway, how are you this week, Daniel?
I'm doing great, Jennifer. How you doing?
I am doing just fine. I
Great.
know before we logged on, before we signed on or whatever we're doing here, you mentioned an article about medicines. Did you want to share that to get us started?
Oh yes, yes. This is from nutritionfacts.org. It's ran by a medical doctor, Dr. Michael, what is his name? Michael Greger. Yeah. He talks about how a lot of these medications, like for high blood pressure and cholesterol, that the benefits of these medicines are highly overinflated to sell the drug. The doctor will tell you that it can decrease your risk of a heart attack or stroke by as much as 50%. But then when you look at the actual studies, what do you say here? It says if taking a cholesterol lowering drug would be, if it had a 50% chance of benefit, most people would take it. But if the chances of a benefit are just a few percent, most people will not take them. And the fact of it is, for most people, the chance of benefit is normally less than a 5% chance over 5 years for cholesterol, blood pressure, and blood thinning drugs. That's not very good odds. But then they go on to talk about, if you eat a whole food plant-based diet, it reduces the risk of heart attack and stroke over 4 years by 60%. And now we have studies showing that overall, 99.4% of patients who stuck with the plant-based diet avoided major cardiac events over the next 5 years. This is huge.
It
So
is
really,
huge.
the doctors are doing you a disservice telling you that if you take this drug, you won't have a heart attack, when the reality is the only way to really ensure that you're not going to have a heart attack is to change your diet and your lifestyle. And that's why I really have a problem with these drugs is, of course, they have side effects, but a lot of people take them and think, well, I'm taking this drug, I'm okay now. So I don't have to worry about what I eat. I don't have to worry about exercising. And this is a complete lie, and it's hurting people's health.
Yeah.
Now,
Yeah.
if you want to take the drug, take it, but you still got to do the lifestyle,
Right. Right. Yeah. We were talking about this on another podcast or maybe between podcasts. That everyone's looking for a quick fix. They're looking for, they don't want to give up, their fried chicken or their sausage biscuit or whatever. They want to be able to eat their comfort foods, the foods they love, and just be able to take a pill and not make a change. I don't want to start an exercise routine. I don't have time for that. I have a client who we worked for actually a couple of years, and I kept saying, you need to start exercising. Well, I'm not ready. And it actually took a couple of years. Now this person is a regular gym rat, but for 2 years, you're not going to see a change without making a change. And medications aren't always the answer.
No,
Yeah. And
especially for
especially,
the most common lifestyle diseases that we have.
yes, yes. And I think that we talked about this on another podcast about a lot of times people think, well, even the doctors will tell them that you have to take this medicine for the rest of your life. And as you get worse, we'll just increase the dose.
Yeah.
Yeah. And it's like, what? And I think I even heard, now you'll know this because you're the expert on heart health, but I think even Dr. Esselstyn said, they'll tell you when you start like blood thinners to watch vitamin K foods like your greens, that can be dangerous. And Dr. Esselstyn, I believe he said it's because your blood pressure could drop and your medication may have to be adjusted.
Yeah,
And so if you eat those greens, you might have to go off your medication. So you better not eat those greens.
of course. And they don't tell you that even though you're on these drugs, the reason your health is getting worse is because they told you that it doesn't matter what you eat. It doesn't matter if you exercise. It doesn't matter. That's why you're getting worse.
Right, right,
Um,
right. Well, and I think that your body gets used to the medication
oh yeah, they start
too.
working.
And so you have to keep adding more as your body gets used to it.
And the more dose of the drug, the greater the risk of the side effects.
Right. I think that I read somewhere that statins are supposed to be used short term. They should
Oh
not
yeah.
be taken long term. And I don't know anyone who has just taken statins for a short period of time. Most people I know are on them for years, years and years.
I think most of these medical drugs were meant to get people out of trouble. And
Mhm,
then as they change their lifestyle, they can be taken off the drug. But the way it works now is they keep you like blood pressure.
mhm,
They'll tell you to be on that drug the rest of your life. And these blood pressure drugs can do a lot of harm to the body. Like I had a friend that was on a blood pressure medication for years. And he goes and gets a different doctor, and the new doctor goes, "Who put you on that drug? This I can't remember what drug it was." He
mhm,
goes, "So and so." He goes, "That pill will kill your kidneys."
mhm.
I mean, it puts people into kidney failure, and his prior doctor didn't even tell him this. I don't know if he even knew it, and so they took him off of the drug he was on and gave him something else. But of course,
Mhm.
they don't talk about eating or losing weight, but that's
Yeah.
you had to be your own advocate. These doctors, I'm trying to, I don't knock them, I'm not trying to knock them, but a lot of them, they have 5 minutes with you.
Right.
They don't
Right.
have time to study and keep up with all these drug side effects. They don't have time, man. They work the crap out of these doctors.
Yeah.
So you need to do your own research.
Yeah. I that sparked two things. One was diabetes medicine. People who
Oh,
have type 2 diabetes, they're put on medication and they're on for life, and it just keeps increasing. They don't tell them to change what they're eating. Sometimes they'll say stop eating sugar, but people don't really know what sugar is.
yeah.
They think it's the sugar they're pouring into coffees. They switch to sugar, artificial sweeteners,
Yeah.
but they don't know about the processed foods and the flours and the other ways that they're getting sugar in their body. And then the other one was the time thing. So my doctor, I go to a functional medicine doctor. She actually just retired, but she actually spends a good bit of time with me, probably 30, 45 minutes. And I go to her 4 times a year. For many of you who have received a diagnosis for autoimmune disease, you go several times a year. And so I feel like she knows me pretty well. We have been going to her for 7 or 8 years for 30 to 45 minutes, 4 times a year. She still doesn't know what I eat. And so she'll say, now you need to make sure you're eating fruits and vegetables. And, you've got to focus on that. No meat. And then like, wait a minute. I mean, she clearly has no idea. So the good thing is she's telling people to eat healthier,
Yeah.
but she's also preaching to the choir here. It would be better if, she had said, what do you eat, in a typical day? What kind of foods do you eat instead of guessing that I'm not eating that way?
That's funny.
Yeah.
You could teach her what to eat.
Yeah, can I come in and teach your clients?
Yeah.
Yes. And so, like you said, I mean, they don't know you. They don't
No.
know anything about you except your height, your weight, and your age, and whatever diagnosis you have on your chart. If you're not already one of their clients, they see your blood work, and blood work is looked at as normal or not normal. And so in functional medicine, they look at functional numbers for optimal health. And so it's much stricter. There's a much smaller wave in there. Like if we look at glucose, blood sugar, fasting blood sugar,
Yeah.
optimally is in a much narrower range compared to normal. And I don't know about you, but the normal American is overweight or obese on 7 different medications or more. I don't want to be normal.
No.
I don't
I
want to
mean,
be normal. And
normal
so
to
I don't,
be semi
yes,
like sick, you know.
right. Don't compare my blood work to someone who's normal. I want my blood work to be better than normal.
Well, I have a friend that's also a vegan, and he told me he's a professor at a local college. He had to get a checkup for his job, and his cholesterol was really, really low. And it's the doctor started to screen him for other diseases because there's some disease where if your cholesterol gets too low, that it could be a signal of some disease. And the friend's like, no, 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 I'm a vegan. The doctor's like, I still gotta look, because the doctor was astounded. Like, he didn't know that a plant-based diet can lower your cholesterol so low.
Mhm.
He has no clue. I mean, some people get
Yeah.
down like 120
Right.
total, you know?
Right. Right. Yeah. I mean, and you don't need to eat cholesterol. Our body needs cholesterol.
No.
You need cholesterol for all your sex organs, for all your sex hormones and your adrenal hormones. But your body makes it.
Yeah.
If you're in good health, you definitely don't need to be. But yeah, any condition, you don't need to eat cholesterol. Your body's going to make it. If your
Yeah.
body's struggling to make it, then we need to figure out why and help your liver with that. But
Yeah.
yeah, that doesn't mean you need to consume it to bring let's not work on that.
Well, you've heard the thing where if you don't eat cholesterol, your body can't build hormones. It's another myth that's
Right,
circulating.
right. You don't have to eat cholesterol. Right. So let's talk about, we've covered a lot of it. Medications in your foods. A lot of times they'll tell a client, well, like with the greens, if you're on heart medications, you need to not eat foods that are high in vitamin K.
Yeah.
You could bleed. You could have a lot of bleeding going on, and maybe it's the other way around. Maybe we need to eat the greens and not take the medication
Yeah.
to improve the bleeding response. And then the combination of meds. So when I was first diagnosed, I was sent to several different doctors, and luckily I wasn't put on any different medications, but this doctor doesn't talk to that doctor, and that doctor doesn't talk to that doctor, and no one knows what the other doctor has prescribed. And so, like, I'm allergic to some medications, and I went to the pharmacy, and the pharmacy luckily caught it and was like, "You can't take this. You're allergic to whatever." But this can happen across the board with different conditions. So you have a client, we don't have patients, but you have someone who goes to their regular doctor, and their doctor runs labs. Their doctor puts them on blood pressure medicine, maybe something else, and then they send them to, maybe they have something going on with their, I don't know, maybe they're suspecting, or maybe they have diabetes. So they send them to an endocrinologist, and the endocrinologist puts them on some other medication. And then they still going to the endocrinologist, and they start having heart palpitations. And so they send them to a cardiologist, and the cardiologist says, "Oh, we need to put you on something else." And so these doctors are not all working together. They're not looking at all the different medications you're on and why you're on. And so what happens is you're being put on more and more medications instead of looking at the whole picture.
Yes.
Yeah.
One of the
And
first things
so,
I do when I get a client is what medicines are you on? And we'll look them up, because
mhm,
sometimes the symptoms the client is suffering from is caused by their medicine.
right.
A lot of times, actually.
Usually that's what it is.
Yeah.
Yeah. Yeah. I had a client who was on two of almost the same medication, and then two other medications that counteracted. They were all for blood pressure and AFib and cholesterol and all that, all of them. So it was 4 medications and then something else because of dizziness and nausea from taking the medication. And it's like, maybe we're on too many meds here. Maybe something else needs to be tweaked. We need to look at the whole thing, you know.
Yes, polypharmacy is a big problem in America. I
Mhm.
think America is the worst country for. It's all about prescriptions. Other countries don't they use more gentle things first.
Mhm.
I mean, we had to do a study in one of my dietetics classes. I think I talked about it last time, but it was called polypharmacy, and the typical 60-year-old is on 14 different medications. And
What?
we go on to learn that this has not been studied. They have no idea. You can't study this. There's so many different drugs. It's impossible to
Yes.
study. Okay, I got this guy on 14 different meds. How do you study that? We don't know what it's doing to the person. They have no clue.
Oh. Right. And then what else are they exposed to? This
Oh,
sparked something else to me. We don't know what all we're being exposed to. So maybe this
oh,
same person on all these drugs is also eating bread that's high in bromide. And so they're not getting iodine into their cells. And so they're taking all these medications. They're also eating foods that have other chemicals. And no one studied how all the chemicals in the different foods interact. So they're
yeah.
having the bread with the bromide, with I don't know. I don't eat this way, but I see it in the shelves and my clients eat it. But they have a food that has yellow dye number
Oh,
5. And
oh,
so no one's looked to see, what happens when you combine bromide with yellow number 5. So now we're having bromide with yellow number 5 with all these 14 different medications.
it's
Like,
crazy.
yes, yes,
Also, every prescription drug robs your body of a different nutrient, whether it's a vitamin or a mineral, and they do not tell you that. I don't even know if they even are aware because they don't say anything.
right. They don't tell you that you need to, increase your vitamin C to help with this, to
Yeah.
help you detox this. Yeah.
Ah, our system needs a revamp. I mean, that's like an understatement. We need a revamp in this country so bad.
Yes. Yes. Well, and then what else is in the medication? So I was at one point I was on Synthroid. Synthroid is one of the most prescribed medications in the US. My grandfather was on Synthroid and he
Wait a
died a
minute.
long time ago, but he was on Synthroid for a long time. And I had an allergic reaction to it. I had to go off of it. Synthroid, the different doses are colored. So like this many micrograms is green and this many micrograms is blue and this many, which is great for the pharmacist or the pharmacy tech so they can make sure they're using the right pill. But why are we putting food dye in a pill for somebody who's trying to improve their health? And
Oh,
so
Jennifer.
yes. So then what else is in the pill? And so I started looking into this because number one, I'm concerned about my health because with
Mhm.
my health condition that increases your breast cancer risk. And then I have a history of breast cancer in my family too. So then that increases more. And so I'm doing whatever I can to make sure that I stay optimally healthy, that I
Oh,
do
yeah.
not increase any other conditions, right? And so I start looking into, what am I putting into my body? So if I had an allergic reaction to Synthroid, which my doctor said no one's allergic to it, it's the most prescribed medicine. People take it, they've been taking it for um hundreds, not 100 years. I can't remember what she said, decades. People have been taking it for decades. And well, just because it's been around for a long time does not make it a good choice. We have to
Yeah.
look at, what else is in here. So then I started looking at other forms of medication because I had the allergic reaction and they add corn to some of them, which, corn may or may not be an issue for somebody. There's all these other different fillers
Yeah.
in there. We have to pay attention to what else is in your medication. You could be allergic to like that. Maybe I could have handled the Synthroid if it didn't have the blue dye in there.
Yeah.
I don't know. I mean, I'm glad that it didn't work out because it made me look at medications. Now I understand medications, whereas if I think the whole thing is for a reason. Why did I receive this diagnosis? I got it so that I can teach other people how not to get it.
Exactly.
Yeah. And so, I mean, there's a reason for all of it. But we have to really look at that. If you're concerned about your health, then look in your medications, ask the questions, where is the insert that goes along with this medication? And read that, is this safe for me? Especially when you're looking at, now vaccines could be a whole nother scary topic possibly,
Oh,
but children are given so many vaccines. So we're talking about medications today, and I'm talking about vaccines. That's still the same,
oh
you
yeah.
know. But there's so many different chemicals in vaccines. And like when I was a child, we would get one and then we'd go back to get another one. Well, now they're putting three in together. And so they're, in an infant, this baby is being injected with all of these different chemicals. And who has really studied the effects of all of these different chemicals going into the baby, you know?
They don't know.
Right. And so we just really have to be looking at, just like we look at our foods, what is in your foods. I don't think people are really looking at what's in their food. Um, Maybe our audiences, but we need to also be looking at what's in our medications. What other medications are we taking? And then what we need to talk about on another podcast, because this could go on forever, is what's in your supplements.
Yes, because some of those are made by pharmaceutical companies.
Yes, and they can be full of all sorts of things that could be reacting with your medications. So,
Yeah,
so many people buy supplements. Their supplements are over the counter. You can pick them up anywhere, and they don't realize that their supplements can really be, cause some serious effects with their medications. I mean, you can't just randomly select a bunch of supplements that you read about in a magazine or heard about on a podcast, or you just saw on Facebook, oh, so and so said this is really great for hair growth. I need to start taking it. So you start taking it, not realizing it's going to react with your medications you're already taking, as well as other things. You really need to look at what you're doing and taking internally.
yeah, you have to become your own detective because
Yes.
I
Yes.
think we live in one of the most polluted environments, and that adds to it. Just from the air, the water, the pesticides, all these things, and all this. Your own medicine. You eat something with pesticides. You breathe something like, I don't know, you're in a polluted town with polluted air. All this goes into your body. There's just no telling what this is doing to your body chemistry.
Yes. So control what you can control. I,
Yes.
I can't control what my air is like unless I move.
Yeah.
Yeah, and so what can I control in my environment?
Yeah. I think that's why what we do is so important because
Mhm.
we teach detoxification and how to eat foods that help your body detox and nourish the body. That's really your only hope in this day's world is like eating as healthy as you can and taking herbs to help assist your body to eliminate some of these things that we take in on a daily basis. We don't have a choice anymore. I mean, it's just the way it is. I mean,
Yes, yes, and to that point, I said we would talk about some herbs too.
yeah.
So many clients. Well, let's talk about heart, since
Okay.
you're very into the heart health. So we have so many clients that are on so many different heart medications, but then there are herbs that can help with the heart as well. And we'll talk about some of those in a minute, but I don't want, another thing that we need to be concerned about is if you're on a bunch of different heart medications, adding herbs may not be the right choice for you in addition to all the meds you're on. So
Yeah.
you need to make sure you work with someone who is familiar with your medication, or do your own research on how herbs can affect it. As a matter of fact, I'm going to take this off and I have a book. I might be able to reach it. I have a couple of books like this. And so I know we're on a podcast, so I don't need to show it on a podcast. But for those of you watching the video, this book is called Herb Contraindications and Drug Interactions.
Everybody
And
should have
this one,
one.
yes, everyone should have a book like this. And this one just happens to be by Francis Brinker. I have a couple of others I don't see right behind me right now, but pick up a book like this. If you really want to get into herbs, you really want to wean yourself off of your medications, you're improving your health, then make sure you get like, I'm just flipping to peppermint. So this tells you, when you should be careful taking peppermint. So peppermint, we're gonna have to talk about this on another podcast too. So
Mhm.
peppermint leaves in their whole form, that's a healthy food, very high in vitamin C.
Oh,
You know,
yeah.
I can chew on peppermint leaves. I can make a peppermint tea.
Oh, I
That is
love
gonna
it.
be perfectly safe for me. I love it. I start every day with some peppermint tea. However, if I extracted the chemicals from peppermint,
Oh, yeah.
extracted that one chemical, and I compound it, and then I inject it into you over and over and over again. So you have high doses of whatever this chemical is, that may be very harmful for you. And so a
Yeah.
lot of times that's what the research is telling you when you're looking at different herbs, like lobelia or chaparral. I mean, they are toxic. Don't take it.
Yeah.
We don't agree with that, but that's because we look at the whole form. So number one, when you think about herbs, think about herbs grow in your backyard or they grow somewhere. Maybe you can't grow them in your backyard or on your roof or wherever, and so you buy them, but you want to buy the herb. You don't want to buy an extract of the herb. Now you can buy a tincture. Tinctures are different too. So we'll need to talk about that on another topic. But I just want to make sure that if you are want to start adding herbs and you're on a lot of medications, make sure you work with a professional, someone who is familiar with your medicines and herbs. Pick up a book like this or one that compares herbs and drugs and their interactions, just so you can be more informed. Yes. So on that, so we were going to talk about heart. So if you're on a lot of medications for the heart, what are some herbs that someone can start to include that are healthier type herbs? What do I mean by healthier? I mean not as dangerous as some of the others.
Well, the first one on the list is always for me, it's gonna be cayenne pepper. I mean, it's a, you know, of common food. And I don't know if I said this before, but they've done studies on people in South America. They have less strokes and heart attacks. And what they found was it is because that the South Americans have peppers in their diet every day, like some form of cayenne pepper, because cayenne pepper acts as a blood thinner and it helps to prevent dangerous blood clots that can lead to heart attacks and strokes. So, and I got a book like Jennifer has, and I've never found anything that kind really interacts with as far as that. Because it's a pepper, like, of course, another great one, hawthorn berry. And also you can also use the leaves and flowers. In fact, there's studies now showing that the flowers and leaves have as much medicinal benefit as the berries do.
Oh,
So
wow.
when I make a tincture now, I use the berries, the flower, and the leaves, and it works really well. I've had it. My chiropractor uses a lot of it because he's having problems in the past, and he's doing really good these days. And I had that little Chihuahua I talked about back in Utah. It helped him out for a long time. He died about a year ago, but he did well for about 4 years, and he was in heart failure. And he lived on I had him on the cayenne and the hawthorn, and he did well. And
Mm-hmm.
he finally died, but he was about 15.
Yeah.
Anyway, I got off topic because it's easy to do. Ginger's another good herb for your circulatory
Uh-huh.
system. Ginger is very good to
Oh,
improve
yeah.
the circulation. What herbs do you recommend
The
for?
first one that came to mind to me when you were talking was hawthorn berry, but then
Yeah.
garlic.
Oh, yes.
Yeah.
I
Yeah.
love garlic.
Garlic.
Yeah.
Yes. And so not a component of garlic, like not taking Allison, which some people do. I
Yeah.
don't recommend it. I prefer you get it in the whole garlic form. But, adding raw garlic to a salad dressing, you know, sometimes that can be kind of hot. You can even, like in my family, when someone's sick, we just swallow a garlic clove like a pill,
Yeah.
a
Mhm.
small enough one. We might have to cut it in half or something, but um, not for a heart condition, but for other conditions. But you can take garlic as well for
Yeah.
heart health. Yeah. So these are foods.
Oh,
We don't
yeah.
think of herbs as being foods, but they are. We're taking them
Mhm.
internally, we're eating them, And so there are a lot. I mean, we're just talking about the heart right now, and we're listing foods
Yeah.
and all the different health conditions. Cholesterol, we talk about, eliminating cholesterol. So no eggs, no
Yeah.
saturated fats. Eating a lower fat diet can help. But garlic can help with that as well. And garlic, is a food. Anti-inflammatory diet. Cholesterol is an anti-inflammatory. It's your body produces it to combat inflammation. So when your cholesterol is going up, you're battling inflammation somewhere in your body. And so cutting back on those inflammatory type foods and adding more anti-inflammatory foods is a great way to help with cholesterol levels.
Great point. Because a lot of people, a lot of the research is pointing to inflammation being one of the drivers of our modern day diseases. And the typical American diet is also a driver of inflammation. So these foods and herbs we're talking about also reduce your inflammation. I mean, garlic, I'm glad you brought garlic up because it is like one of the major herbs in my opinion. It lowers the cholesterol, it can lower the blood pressure, it thins the blood, it fights infections. It's even good for your prostate health, they're finding now.
Mhm.
I mean,
Detoxification.
oh yeah, it's really good for detox.
Yeah. Yeah.
It's exciting. This is one of my favorite topics. Food as medicine. You know?
Yes. Yeah. And it is.
Yeah,
It
it
is.
is.
Yeah.
Uh-huh.
I mean, from the beginning of time.
Yep.
Yes.
It wasn't until the last 100 years that they bring in this synthetic medication and they try to say that it's better for you than the natural medicine, but it's
Because
not.
it can be regulated. Because it can be
Yes.
regulated. Yes.
Yes.
Yeah, we can give you an exact dose of this
Yeah.
chemical combination here, but we can't give you an exact dose of garlic because all garlic cloves are a different size.
Yeah.
Yeah, all
Just
different cayennes come in different forms of heat.
yeah.
Yeah, and so
That's simple.
it's
Just eat
harder to
more.
regulate. Yes, that's right. Yes.
You
Yeah,
know?
and so cayenne is a fabulous food for so many different reasons. And there are people who have nightshade sensitivities.
Yeah.
If that's you, then go with the garlic while we work on repairing your nightshade sensitivity. That is something that can be repaired. But if you're not sensitive to nightshades, then I strongly recommend that you start incorporating cayenne every day. Do your own research. I'm not telling you what to do. Do your own research. But if you can just add, like for me, we grow our own cayenne and then we dry it and grind it up. And so I sprinkle it on food every day. I sprinkle it on my salads and my dinners every day. In Dr. Christopher's program, especially if you're going through a detox, then you're taking it 3 times a day. It's in his formulas, it's in his lower bowel formula, because it has so many different benefits. Cayenne does, and that's something people go, "It's too hot, I can't take it." But if you get used to putting it on, like I don't even notice it on my salads and my dinners anymore. Where it used
Yeah.
to be, it was hot, but now you work your way up until you can tolerate a little bit more. But I think it's a food. It's a food that's good for you.
Excellent. That's how Dr. Christopher, he had the rheumatic heart disease, you remember?
Mm-hmm.
And his
Yep.
blood pressure was really, really high. And I think he tried to get life insurance when he was 35 and they
Something
wouldn't
like
give
that.
it to him because the blood pressure was so high. But then he discovers cayenne pepper and the diet. And so he gets rechecked when he was 45 years old.
Hmm.
And his blood pressure was, they said, man, your blood pressure is like a young man's blood pressure, like 20 years old. And it's because of the cayenne pepper and the mucilus diet, which is a plant-based diet. But
Yeah.
um, and this is why this is what makes me so passionate because a lot of people are told that, well, you have genetics for heart disease or you have genetics for cholesterol. But it doesn't have to be your fate. You can
Right.
change your life. You can change your health, you know?
Yes. A lot. It has to be um, a series of things. You have to have the genetics. You
Hmm.
have to be in the certain environment, and you have to have a certain condition that you know. Like for me, I have the genes for celiac, but if I don't eat any wheat or any gluten-containing foods, guess what? I'm not going to have
Yep.
celiac. But if I have the genes for celiac and I have leaky gut, have intestinal permeability, and I eat gluten, then I'm going to have a flare. I'm going to
Oh,
have
yeah.
serious condition. If I don't have intestinal permeability and I have the genes and I eat gluten, but my intestines are strongly intact, then I could probably eat gluten occasionally.
Yeah.
But I do have to remember it's going to cause some inflammation in my body. Gluten causes inflammation in everybody's body. And so
Yeah.
if I eat gluten regularly and I feel good, but I'm still eating it regularly, it's going to keep causing damage. Then I'm going to create I'm going to create intestinal permeability. And then I am going to have a celiac flare. And so I have to make sure that I keep my intestines strong because I can't be unexposed 100% of the time. But I
Yeah.
need to keep that strong and avoid gluten as much as possible. But that goes with all genes.
Oh, yeah.
Yeah, you have the high cholesterol gene, but you have to have the gene, you have to be eating the high cholesterol foods or inflammatory type foods too. You know, if you can have the gene and not eat those inflammatory foods, you're not going to get the
Yeah.
condition.
But I
Yeah.
think some people, if a doctor tells them you have the genes for a certain condition,
Mhm.
some people in their minds go, well, if it's inevitable, I'll just have my
It doesn't
gluten.
matter what I eat.
I'll
Yeah.
have my question. And that is just
No.
ridiculous thinking.
Right. I think that there are two genetic conditions that if you have the genes, you have the disorder. There could be more than two, maybe if it is, it's a very small handful, but you know about those at birth or the
Yeah.
first 2 years of life. If you're an adult, then that's different. You can have the genetic tendencies and avoid the environment that causes it and not have the condition.
The power is in your hands, which is very
Yes.
liberating. It's very liberating. I mean, you can,
Yes.
yeah, yeah,
Yeah, it gives you hope. You can improve your health. You can work with someone to reduce medications.
hmm,
You can change your lifestyle. You can change your diet. You can exercise, doing the right form of exercise, not over exercise, because
yeah,
that can be an issue too. But you can find the right balance and improve your health.
yeah. And hope, life without hope is not a good life, but life with
Right.
hope is excellent, because
Yes.
there's studies showing now that I think we have over 90% control of our genes, like, so like we're talking about,
Yeah.
as far as how you live, what you eat, what you think, how you exercise. That's huge. I mean,
Yes. Yeah.
I think it's the epigenetic studies. I think that's what they're called. That's how
Right.
they're,
Hmm.
yeah,
Yeah.
it's very
Yeah.
interesting.
Yeah, I love it. I do DNA analysis.
Hmm.
And so I studied mine and my husband's and my children, and then a couple of clients. And I love going through it because as I go through theirs, and I'm like, I'll learn something new. And then I'm like, oh, I have to go back and check mine and see.
Yeah.
But there's so much, that shows, different foods. And these foods are better for you, and this form of exercise is better for you. And
Wow.
it's just fascinating. It's fascinating to me. And then I go back and look at mine. I'm like, oh, I should be adding more of these foods, or.
That sounds like a really valuable tool to have.
Yes, yes.
Huh.
Yeah, it's really cool. Yeah, because I had a client recently who there was a certain um disease that some people in the family had had, and they discovered there was a gene tied to it, and they wanted her to have genetic testing to see if she had that gene.
Yeah.
And I was able to tell from my chart. Um Luckily for her, she did not have that specific gene, but she did have other genes that were related to it that are not it. And so that tells me that it could be that even though they have the gene, they have these other conditions too. Like for me and my own genes, high cholesterol runs in my family. So we thought we had the cholesterol gene. However, we have all these genes that are clotting factors
Yeah.
and a lot of other heart type genes that are not the cholesterol gene, but these other heart genes that can cause inflammation, which can raise cholesterol. And so while we
Yeah.
thought we had the cholesterol gene because everybody was on statins, it's these other heart related genes. Yeah,
Wow.
but you can change your lifestyle to improve on those too. Eating lots of greens can
Oh, yeah.
definitely help with that.
Oh,
But
yeah.
we get nerdy, and we're not focusing on the meds here. But I just want everybody to know you can go off your medications safely when you work with someone who knows about different medications. So make sure you take care of you, be your own advocate.
Yeah, the best way to do that if you want to get off some of your medicines is start living with the lifestyle changes, plant-based, then have your doctor, tell your doctors what you want to do. And over time, your health will start to get better. And then the doctor can start to reduce your dose. That's the
Yes.
safest way to do it.
Yes. And if your doctor is not open to you increasing exercise and eating more plants, then you definitely need another doctor.
I agree.
Yes.
You want one that's wants to work with you.
Yes. One that is interested in helping you get better.
Hmm.
Yeah. Not just putting you on medication.
Exactly.
Yes. So I don't know what we're talking about next week. We've brought up a couple of topics today that would be great to talk about.
Yeah.
Yes. So tune in. It will be something related to what we just talked about.
Yeah.
Thank you
Oh,
for joining us this week. Did something come into your mind,
I just
Daniel?
hope no, we're good. I think we got off topic a little bit, but this is interesting talks. Lots of passion here.
Yes. Yes. So let us know what else you would like to hear about. Message us. We love to hear from you.
Oh,
We want to
yes.
know what you would like to learn about too.
Yeah.
And so thank you and join us again next week.